Let's see. Hey everyone, I'm Vina. I'm not used to, this is my first Facebook Live, so might be kind of getting used to things a little bit, but Abby walked me through kind of how to start it, and really happy to be here with you guys in this online community. Um, and it's been wonderful being in person with you, and I do miss that. And I know the Bounty and Soul community misses everyone being together. But Bounty and Soul's been so amazing at still getting meals together and still serving the community in a time that really means even more when there's even more need. So I wanted to kind of take this time to talk a little bit about what's going on in our community. Obviously, this is a challenging time for all of us. For myself in healthcare, there's a lot of unknowns, and the economy, and families and schools, and everything was kind of thrown out the window, and we needed to figure out from scratch everything right away. And everything changes even so much day to day. So I appreciate you all being here, um, and being here together and in the way that we can be here. So I was going to take just maybe 5 or 7 minutes to talk about COVID, talk about this pandemic that's been going on. And because I know there's a lot of uncertainty. Some people, I know there's a lot of information you can find online, but there's almost too much information. And even I kind of can get caught up in a lot of it. And so it's nice to just kind of unpack it and boil it down to, what is it? Where did it start? How contagious is it? What does social isolation mean? How can we all stay safe? And, what can and can't we do? And what this is going to look like maybe for us in the future. And then I'm happy to take questions too. I'd love to field questions and comments. So if you have any, please type them in, and we'll get to those too. So hey Leslie, good to see you. So yeah, I just wanted to talk about COVID-19. So it is a respiratory virus. Similar to the flu, is also a respiratory virus, and it comes from the SARS family of viruses. So it started in China. So they first saw their first case December 31st, at the end of the year. And we started seeing the first case in the US in January. And so, it's only been really a couple months since we started first seeing COVID-19, coined for starting in 2019. And we've had, over, I think I was just looking it up, the numbers today. So, probably 140,000 cases, but, so in a couple of months. But these numbers are off, and that's due to a number of factors. One is because we're not testing a lot of people, and that's I'm not going to get into the politics of it. That has to do with just sort of the readiness of being ready for a pandemic, from who's on the president's panel, to also just what's manufactured in the US as far as having the right protective gear. And it goes down a lot of different avenues of why we're not prepared for this. And that can be for another call, or maybe in the questions. But that's where it started, and we've seen it really exponentially grow. To give an idea of the growth of COVID compared to other viruses, so flu, they measure something called an R0, which is just how reproducible a virus is. And so flu, if you get it, you're likely to infect another maybe 1.5 people. With COVID, this specific coronavirus, you're likely to infect 2 to 2.5 people. And again, that number might be a little bit off because we're still learning a lot about this new virus to us. But so it's potentially about twice as contagious as flu. So, there's many different ways of going about a pandemic as far as decreasing the spread. But one way is to decrease the exposure that you have to other people. And so, one of the ways that you can do that is you can just isolate the people that are most at risk. So, those would be elderly people, those with asthma, other lung conditions, those who are just immunocompromised for whatever reason. That can be cancer, autoimmune disease, obesity, prediabetes. So that's a lot of our population, is at increased risk. Young and healthy are typically very protected. Typically, of course, you can always see stories in the news where young and healthy people are getting pretty bad, and they're in the hospital, and needing respiratory support. So that we're only testing kind of the highest risk folks that are in ICUs and in nursing home facilities and healthcare workers that are sick, and that's because of the contagion of the virus. So, so a little bit about sort of its clinical course. So basically, we're advising everyone that is having symptoms to stay at home and stay in kind of social isolation, self-quarantine. So the difference between social isolation and self-quarantine. So self-quarantine is when you're actually having symptoms, and that's when you're very likely to spread the infection. Incubation is about 2 weeks for it. So, the recommendation, CDC has changed this as they're following it out a little bit more. We're very lucky to have information from New York, and China and other countries to kind of see the follow up a little bit more. So we're very lucky in that way. But so now I think the CDC's latest recommendation is 7 days since symptom onset and at least 3 days symptom free, meaning fever and cough. So most people, about 85 to 90% of people, will start out with a fever greater than 100.4. I know it's hard to find thermometers in the stores. That's what I'm hearing a lot. There's no more thermometers. But typically, many people will start with a fever, and maybe that's it, and just kind of not feeling right. Oftentimes, there's a dry cough. Shortness of breath follows, usually several days in, maybe four or 5 days in. So it attacks the lining of the respiratory system. So you can feel short of breath, and you can kind of decompensate fairly quickly, and that's why there's a lot of fear around this. It's right, it's hard sometimes to differentiate it between other things like allergies, which everyone's having increased allergy symptoms now, and even the common cold. So, but those are kind of the differentiating factors. Usually it starts with a fever, like I said, greater than 100.4, then has, usually day 4 or 5 start with that shortness of breath, and sometimes even pain in the chest. I've heard patients describe it as it feels like a squeezing, like I can't get a full breath. I've never felt like this before. It feels different. So, how common is it? It's, in our area, and if you're in North Carolina watching this, we, are lucky in that I think we did isolate fairly quickly. And like I said, we do have, the kind of looking 2 weeks out, looking 3 weeks out, looking 4 weeks out from other cities of what this looks like. And they've had a lot of people recover from this, where we're just starting to get the first cases. We are limited in that our testing right now takes 4+ days to return. So that's, pretty archaic when it comes in the antiviral world. There are some rapid tests that were not FDA approved that South Korea used, and they tested everybody right away. And then they could say, okay, you need to quarantine. You can, don't need to quarantine. You're not, because a lot of people are asymptomatic carrying coronavirus. They're not having symptoms. So the asymptomatic folks are not as likely to spread it, but they still are carrying it and they can spread it. So that's why we, are doing this social isolation. It's not anything that anybody wants. It's not good on healthcare. It's not good for, businesses, for sure, small businesses. It's not good for, parents. My husband and I are both in healthcare, and we're trying to flip flop schedules because kids are out of school. So, it's, but there's a lot of changes that we've been going through, and I think there are a lot of good things too, which it's important to, I think, try to remember. Social isolation, what does it mean? So it means staying with your kind of cohort of people, so your family unit, or if you live alone, it can be up to 3, 4 people, but you are not then going in and interacting with other people. It's not 7 people getting in a car together, going for a group trail run. It is, you can still go outside, you can still hike. You don't want to go to crowded places, and basically it comes down again to that R0. You go out and you infect somebody else, you're asymptomatic, you feel fine, but you're carrying it, you infect somebody else. They, go home to their family and they infect somebody else, and so on and so on. And that's how it spreads. So, so that's just a little bit on what that means. If you have it and you're trying to figure out, sort of safety and what can I do? How can I not spread it to other people? I'm in my home. I'm with my kids. I have a little kid. What do I do? To the 90, like somewhere over 95% of the spread of coronavirus is from hands to mouth, hands to face. So people get conjunctivitis. People will, get more nasal symptoms sometimes, less common with coronavirus, or you get it, by touching your face. So the first thing that you can learn is, just get in the habit of doing is not touching your face. Really, that's like so much bigger. I listened to a webinar the other day at Pulmonary Critical Care up in New York, and he said, really, like the masks, there's a lot of talk about masks and the public wearing masks, and the public does not need to wear a mask. If you're having symptoms, you should wear a mask. But if you're not having symptoms, a mask is not going to protect you. Maybe it's a good habit. You can learn how to use a mask and how to, really it's more of a barrier to touching your face. So the most important thing is to not touch your face. And then, the reason that there's a lot of talk about not having enough equipment for healthcare is twofold. One is a lot of the N95 masks that really, are we do fit testing for and make sure no smells and no aerosolized droplets can come through. That's really for more, like my husband's an emergency medicine physician, and that's really he even just uses that when he's doing a procedure on a patient we suspect COVID. So everyone does not need to wear those N95 masks. If you, have any, give them to healthcare workers. They could use them, but that's when that is needed. So really, it's just regular mask. If you're self-quarantining in your home, quarantine in a separate room, and you can come out for meals. Good hand washing, 20 seconds at least, and hand sanitizer. Kind of, even touching a doorknob, use hand sanitizer, before you're going to touch your face. But it lives on different surfaces for different amounts of time. So they have actually, tested in healthcare areas, printers and stethoscopes, and so we're pretty diligent about wiping everything down because those all can live on there. Let's see, the CDC and the WHO, WHO, World Health Organization, have good information on their websites as far as more information on coronavirus. Also, Google has their own page now, which is actually probably even better than the other ones. And then there's an app that I have used that's called Newsbreak. And it has kind of the local listings of the restaurants, that are offering takeout, and local, tailgate market information, and just how you can support your local businesses. And it also has the coronavirus information, and which is updated daily. So I really like that one. What else? What questions do you guys have? They are looking into plasma testing in New York right now. So they're actually testing people now that have recovered and on the other side of it, to actually test their plasma, and if they come back positive as far as not being able to, gaining the antibodies needed, they can actually use those to critically ill, severely compromised patients to help boost their immune system and their immune response. in coronavirus. But they're really in a shortage up there, and it's really scary to kind of see what they're going through. I do some telemedicine also, and I'm talking to patients up there, and I've talked with infectious disease doctors up there, and they really, like, on a daily basis, are deciding who they can help and who gets the ventilator. And it's really overburdening the healthcare system, which is what the social isolation is trying to do. It's trying to flatten, many of you have probably heard this, flatten the curve. So we're just trying, we know it's going to hit, and but we're trying to delay it so that we have time to not overwhelm the healthcare system. And maybe we'll have a rapid test soon. I think it's coming, and we're going to have access to that soon, which will be very good. And we also have time to maybe get a vaccine. So I think there's going to be coronavirus vaccine. Obviously, a lot of companies are trying to race to figure it out. And then, that vaccine is actually thought that it would cover a couple of years. This virus mutates very slowly. So if you get the vaccine, it'll probably just, coronavirus will now be part of our, you get the flu, you get coronavirus, you get, but there will be a herd immunity. So once 60% of the community gets the coronavirus, then there's something called a herd immunity, where the other people who are unaffected are benefited from that. But we're not there. This is a new virus, and so that's why that explains some of the social distancing, and that's frustrating as well. But the good things, I think, I think a lot of families are spending more time together. Um, Usually, hopefully, that's a good thing. I think people are connecting as a global community in ways that I haven't seen before and felt as much. Nature is kind of coming alive without the pollution, and I think there's a lot of really beneficial things. I think people are learning to cook at home out of necessity, probably saving some money, realizing, oh, I can, meal plan and make one trip to the grocery store once a week. So these are all things that we were, it was so hard to get people to do because it was just so easy. Everything was so convenient. And now that's been taken away. So I think there's actually a lot of, sort of this slowdown. You're going to say it was meant to happen, but I do think there's some takeaways that we can bring out of this that I'm hoping changes the healthcare system. I think there needed to be kind of a crash, something big, something like this, to say, wow, we were not prepared for this, to really make change and make political change. So there's a question about, what does flatten the curve mean? So basically, this exponential rise that we could see if we were all just, forget it. Like England actually did this. So they said, you know what, we're not going to, it's too much of an economic impact to shut everything down. We're just going to have everyone out there together. And that's what they did. And it just absolutely instantaneously overwhelmed the healthcare system. And people were not able to get, people who were in distress, like severe distress, needing respiratory support, were not able to get the help that they needed, that they went back on that, and then they socially isolated. So that's what that means, of flattening the curve. So the numbers of cases, they're still increasing, but it's over a long period of time versus just going exponentially higher, which would overburden the healthcare system for sure. So the difference between social isolations, or stay at home for 2 months versus 2 weeks, was huge. It was like 14, this was nationally, about 14 million compared to almost 200 million affected. So it was a huge difference. And I think it was the right move for North Carolina to make the, to extend it to the end of April. But it's still challenging, and I really appreciate all the efforts that everyone's making to follow those guidelines, and just keep people's safety and best interest. State parks have had to close because not everyone is following that, and they're meeting in groups in the woods, and trying to get that outside outlet, which I totally feel. But it's important to just stay stay in your small group, and you can still be outside. You can still. We actually just got back from camping, but we were just in our little unit, and we were out in the middle of nowhere, and that's okay. So, what other questions do you guys have? I know you guys have probably heard a lot of COVID stuff. Do we have enough PPE? Um, I have in urgent care, we do. We now there's a lot of places, and even local people making masks. And like I said, with really more coming out about how the N95s particularly are not as needed for unless you're really getting close up to them and intubating a patient, putting them on a ventilator, then the N95 is not as necessary. So, I think they're ordering maybe some more face shields. Also, that's important. We're definitely not wearing like what we've seen in some of these videos from China. And to be honest, they haven't really even come up with that guideline here. So I think so. I really think a lot of it was from hand to face, like I said. So after hand cleaning, what Leslie's asking, what can I do to keep myself and my family safe? So when you're with your family, if you're not having symptoms, I mean, and you're been self quarantining. I mean, you can go about your daily routine. There's nothing specific that you need to do. But if you can cough and sneeze into your elbow, not getting that on your hands, of course. We keep hands. I mean, our hands are all pretty dry from overwashing and just being, especially being in healthcare. Just showering straight. If we can't shower at work, shower straight away. At home, wash the clothes. Husband's leaving his at work. They have a scrub machine, so that's good. But yeah, that's the best that you can do is hand washing, and of course, if you are sick, coughing, to wear a mask and minimize exposure. You can wipe surfaces down that you use often, like refrigerator door handles and things that we don't always think about, but things that get used a lot. Um, but yeah, let's see. Any other questions? Are you guys getting the support that you need from Bounty and Soul? Abby and team have all been really amazing as far as um, the notes and getting the food out to people. And I'm so thankful for Bounty and Soul, and especially in this time of need. So I hope you guys are taking advantage of some of that and taking advantage of the sunshine outside, vitamin D. So it's another thing. So supplements. What can you do to kind of boost your immune system in this time? So it's easy sometimes. You're home and you're trying to think of, okay, I'm going to get all the non-perishable stuff because we're in this apocalypse, and you get the boxed crackers and all the processed stuff, which maybe you even normally wouldn't eat as much of. So not a great time to really get into binges of processed food. So boosting the immune system, again, whole foods, plant rich is great. Lots of hydration, vitamin C. They've actually been studying vitamin C specifically for even treatment of COVID, and so it's really great as prevention as well. So a gram a day of vitamin C is really good to just be taking. Vitamin D, and I'm a huge proponent of vitamin D, and it's been studied for flu prevention and respiratory, just common cold prevention anyway. I think almost everyone, I mean, maybe rarely there would be a contraindication to not do vitamin D, but 5,000 a day in the winter, if you don't have your levels checked, I mean, it's kind of a rough guideline. And high dose, if you feel sick at all, it up it to 10,000 for a few to 5 days. Will Bounty and Soul be giving out plants this season? I'm not sure. Abby might be able to answer that one. Um, I know obviously the flowers. I saw a picture of beautiful flowers that went out recently. So this is a great time to plant seeds. Do I see an end coming to this virus? So, um, so as far as an end to this virus, yes, I think this is more of, no one wants to hear this, but I think this is more of a longer haul. Um, I don't necessarily think we'll need to be in like social isolation forever, but I do think that we need to get over this hump, this first initial hump. And then I do think these rapid tests are going to be available hopefully in the next few weeks. I think there will be, like I said, every day there's so much change as far as how we can better go about manage it. Um, we're dealing with a really unprepared health system, and we're having to show up every day to work in a system that is just not good, and um, was already overwhelmed in the first place. So I do think there's an end to this. I think, this could be 18 months. Um, but I don't think that whole time will be as acute as this period. I think we'll keep seeing the virus for a long time, then where we have this herd immunity where 60% of people will get it. And, kids get this, it'll look like a running, it just looks like a very mild cold. In fact, they're the lowest risk group, 0 to 10. They're not even on the map whenever they do all the charts. The elderly are the ones most at risk. So, and like I said, people with very acute respiratory symptoms. So, people that are like over age 70 are at the most risk. And It's so bad in New York. Well, obviously there's so many people in New York, right? And it kind of hit there in the beginning, so they didn't really know what this was. And there's so much international travel, right? So many flights that go through there, and it was just spread from person to person to person. And there's so many people there. It's hard to even socially isolate at all there. So it's really very bad up there. I haven't seen big numbers in the Carolinas. Florida has a fair number of cases. Washington State, California, New York, New Jersey area for sure. How long do I think we'll socially isolate? So obviously, I can't give the final answer on that. But I think probably, we'll see what this virus does. I mean, every day it's changing so much. I think we just need to like flatten that curve. And right now we are a couple weeks ahead or behind, like New York. And so, like even our patient numbers are lower right now in the ER admission, and I work in urgent care, so those numbers are actually lower right now. We're actually not needing to staff quite as much right now, but we're sort of waiting for this storm to come. And I feel like probably in a couple of weeks we're going to start getting more of them. But I'm hoping that we don't get hit, at all, like some of the states that have been hit the hardest, because we have that much more knowledge, we have that much more lead time. So I think in that way we're very lucky. So I don't know that social isolation will go much past the end of April. Now, the kids are already out of school until mid-May, so I don't really think that they're going to be. I mean, I think it's pretty obvious they're probably not going to be going back this year. Um, and then co-infection rates is one thing that we haven't talked about. So co-infection, you can get both the flu and coronavirus. So previously it was thought, okay, you tested negative for flu, we don't need, there's no chance that you could have COVID. So it's not as likely, but there is about a 10% or so, as far as we know so far, co-infection rate, where you can get a respiratory virus or that causes the common cold, and you can get COVID. So we're not testing everyone because there's no treatment for it. There is no specific treatment. If you're short of breath enough that you feel like you need assistance with respiratory support, then you go to the ER, you go to the hospital, and then you get that care. But if not, you really, I mean, it's not fun, but you manage it at home. There just really isn't the healthcare resources to have everyone, coming to the emergency room for it. So, um, any other questions? I don't know too much about dry skin brushing for this. So, can you get the coronavirus again in the same season? So, like flu, you can get it again. So, not sure. They're looking into it. I think because this virus does mutate so slowly, it is unlikely, which is why I kind of like, you can get it, and then you're pretty much you've built up those antibodies to be clear of it for a little bit. Um, so in New York, they're like I said, experimenting with plasma testing. So yeah, if you do get it, I mean, you just definitely want to boost that immune response again. Vitamin C, like I said, they were using vitamin C to test or to actually treat coronavirus or any virus. There was some thought that you should not use ibuprofen, that you should just use Tylenol. They've kind of retracted that. It's fine. There was some debate about elderberry, but elderberry is still really good for flu prevention. So we made a batch of elderberry last week and we still take it. I mean, there's still a lot of flu going around now. So, I don't think we should forget about flu and making sure we at least protect ourselves against that and vaccination against that. Um, but yeah, I mean, you guys are, Bounty and Souls providing such amazing plant-based foods. So eat those plant-based foods, cook healthy meals, eat together, spend time with your family, read the news, but don't get, caught up in it, because I don't think that's going to help a lot of, we've seen a lot of increased stress and anxiety right now too, and just of the unknown. So I think now that you're, empowered and kind of what our future holds and what you can do to prevent yourself from getting it. So no, hand to face contact. I think you can have a lot more confidence about it. And, it's not just like, oh, I'm going to be near somebody and I'm going to get it. So, still to maintain that kind of 3 to 6 foot distance as far as outside. But yeah, it's different times. It's different times, and we're all learning. But I do think that we will, we'll come up out of this and stronger and more um, sort of tied together as a community. And I think we'll start looking. I think it'll kind of create the whole world to look at things in a different way. I mean, how often do we have these global issues that really, we're all sharing? So it's been an interesting experience, and we're just waiting kind of for what it's going to look like here, but really hoping that the steps that we've already taken have limited, obviously that's why we're doing it, right, have limited um, where it's going to go or how long it's going to take. So if you guys have any more questions, you can feel free to message me. I do have my own coaching website, vinasamanimd.com, and you can get on my Instagram and stuff. So happy to see you guys over there, and I'll definitely be back at Bounty and Soul, or maybe even do another one of these Facebook Lives. Probably everything that I've said is going to be all out the window in a couple weeks. So, but yeah, I really appreciate you all and Bounty and Soul, and for you guys having me today. Thank you guys.